All right, good morning, everyone. We'll go ahead and get started with our webinar this morning. My name is Roshan Egan's. I serve as the program manager with the Latino Coordinating Center for Tobacco-Free California. Very excited to have you all join us this morning as we discuss this very important policy of preventing, or this very important focus of preventing exposure to secondhand smoke and aerosol among the Latino community. For those that are joining us for the very first time, we're glad that you're here to join us. This is our third webinar of our 5-webinar series, introducing the policy platform and our 4 policy priorities. So this priority here, this focus that we are going to discuss today, is the second policy priority within our policy platform, which again we'll talk about as well momentarily. We're glad to have you join us this morning. The webinar is for an hour and a half, as we are going to be joined by a group of panelists who are going to be sharing their expertise to complement the information that we're going to be providing, which of course is also found in the policy platform. So I'm glad to have you join us this morning. So we want to briefly review our objectives for today. For those who are not familiar with the Latino Coordinating Center, we're going to briefly reintroduce ourselves and the services that we provide. We'll also provide an overview of secondhand and third-hand smoke, as well as the aerosol that is emitted from electronic smoking devices, and exactly how does that impact the Latino community. We're also going to identify specific policies that are aimed and designed towards reducing the secondhand smoke and third-hand smoke exposure among the Latino community. And last but not least, as I briefly mentioned, we're going to have a group of panelists who are going to be sharing their best practices and recommendations on how to implement the policies that we're going to discuss this morning. Also, as we have done before, we want to make sure that we let everybody know that for this webinar, we're going to use the term Latinos. This is a term that we utilize in our policy platform, and as previously mentioned, this is still the term that is more utilized among the older Latino community, and specifically our Spanish-speaking folks. However, that's not to say that everybody identifies as Latino. We recognize that we go by many names. We're not a one-size-fits-all population. So we encourage all of you, when you're working with the Latino community, to get to know them, to see which term is most appropriate for the community that you serve. But again, we will be utilizing the term Latino for this webinar. I've seen also several introduce themselves in the chat box, and we're welcome to do so, so we can see who is represented this morning, who's joining us from what part of the state. So feel free to introduce yourself in the chat box if you haven't already done so. It's also just great for us to see who is here with us. So the Latino Coordinating Center, hopefully you have heard of us before. If not, again, we're glad that you're here to join us. We are a program of the California Health Collaborative in partnership with USC. So we're one of the 6 coordinating centers focused on working with regional regional party population projects, focused on specifically, of course, in this case, with the Latino community. Our goal, our mission is to improve the overall health of the Latino population in California through the implementation and adoption of policy change that help to reduce these disparities among the Latino community. In addition to that, we also aim to facilitate and create statewide collaboration among our colleagues, among everybody here this morning, but also we aim to empower the community to mobilize on their own, to be able to advocate for themselves, to engage with elected officials and other tobacco control partners to ensure that they can also push forward and protect themselves from these policies, or from these disparities, I should say, that impact our communities on a daily basis. I mentioned the 8 regional projects. So these are the programs we work primarily with, many of which are here with us this morning on the webinar. And so we work primarily with them, but we also work, quite frankly, with any other organization, whether it be a competitive grantee, a local aid agency, or a statewide. Any organization that wants to work with the Latino community, we're here to work with all of you. So if there's any way that we can assist, please feel free to reach out to any one of us, and we'll be glad to collaborate on the most appropriate manner. So let's dive into secondhand and third-hand smoke. And I want to touch on this somewhat briefly because we understand that this is a topic that for many of us we are fairly familiar with. But what I really want to emphasize is the connection with the Latino community and how exactly the Latino community is impacted by secondhand and third-hand smoke. I think it is no secret that secondhand smoke, there's no safe levels of it. We know it includes toxic chemicals, with 70 of which are known to cause cancer, also known as carcinogens. Most recently, there was some research conducted that found that prenatal exposure to secondhand or to tobacco smoke may also increase the risk of acute lymphoblastic leukemia. This same study also found that Latino children or Latino infants were also more susceptible of being diagnosed with this form of leukemia compared to other racial or ethnic groups. Among children, we know secondhand smoke exposure can pose a serious threat to their health by increasing the risk of asthma attacks, of respiratory infections, as well as increasing the risk of sudden infant death syndrome, or SIDS, which we know is one of the leading causes of death among children all throughout the United States. And moving away briefly from the public health perspective, we also know that secondhand smoke exposure is also linked with poor academic performance. So if we also want to consider what type of impact does secondhand smoke have at the social level, at the academic level, well, this is an answer to that. I wanted to highlight briefly, again, I'm highlighting Mexican-American children, but this is only a small snippet of the large Latino population. But according to the CDC, during 2011 and 2012, nearly 30% of Mexican-American children aged 3 to 11 were exposed to secondhand smoke. Again, this is only referring to Mexican-Americans. This does not apply to other youth and young adults who are identified as differently. So what this really indicates is that more than a quarter of Latino children are constantly exposed to secondhand smoke. This puts them not only at a high risk of severe health consequences, but also at a high risk of falling behind in school, of having poor academic performance. And of course, we know that that might also translate to a lower risk of acceptance to college, and of course, everything else that comes with that. Also want to touch on third-hand smoke. Third-hand smoke refers to the toxic residue that sticks onto the surfaces and objects after a person is smoking or while they are smoking or using tobacco. Now, people come in contact, the third-hand smoke chemicals are absorbed into the body, either when the skin touches the surface. So if there's third-hand smoke residue on a table and somebody touches that and maybe touches their mouth or perhaps their eyes, then the third-hand smoke chemicals are then transmitted to the body. Also, when they breathe in third-hand smoke chemicals that are still in the air, or also, and this is a major concern, when they swallow the residue that oftentimes are found in objects. So as you can see here on your screen, when there is third-hand smoke residue on toys and there's children or babies in that household, they put that in their mouth and literally are ingesting the toxic residue that is left behind by the tobacco products. So this is of major concern, specifically as we talk about young adults and young children, I should say, and infants. And secondhand aerosol, I wanted to briefly also touch on that, is that this issue, there seems to be, specifically also in the Latino community, a lack of awareness of how harmful the aerosol is, the aerosol that is then released from these electronic smoking devices, or ESDs. I recall in several presentations speaking with Spanish-speaking parents, they were told that it was only water vapor, that vaping really isn't harmful at all. And so this also is one of the reasons as to why we see higher rates of vaping among youth and young adults who identify as Latino, because the parents perhaps don't necessarily have all the information sufficient enough to then perhaps talk to the children about the harmful chemicals or the harmful consequences of vaping. We know that the secondhand aerosol transmits or also releases ultrafine particles, which at least 10 of those chemicals have already been identified or listed by California's Proposition 65 list of carcinogens and reproductive toxins. So to say that vape or that aerosol is harmless, that quite frankly is not true. It is also harmful and it poses a risk to those that are nearby. In fact, exposure to fine and ultrafine particles may also exacerbate respiratory illnesses such as asthma, and may also constrict the arteries of the body, which could trigger a heart attack. So again, to simply say that it is harmless, again, I want to emphasize that is simply not true. And the first study to look at the exposure to aerosol from electronic smoking devices found that non-smokers who were exposed to conventional cigarette smoke and to the aerosols absorb the same level of nicotine. So we want to make sure that we identify, first of all, that we're aware of how harmful this is, but also then look to see where are Latinos more exposed to secondhand, third-hand, and aerosol. And with that being said, once we identified those areas, we then need to identify how can we address that, how can we reduce that exposure. So during our time this morning, we're going to be discussing about specific policies and specific settings in which we have identified as settings in which Latinos are highly exposed to secondhand, thirdhand, as well as aerosols. So with that being said, I'm going to pass it on to you, Ned, who is going to discuss more about the need to implement and support tobacco-free multi-unit housing policies to prevent and protect our Latino community.
Thank you so much, Rosendo, for that introduction. And I'm excited to be here to talk about multi-unit housing. It is an important topic for me. All of tobacco control is, but this is one of my favorites. I also wanted to, before I get started, I wanted to clarify what I mean by multi-unit housing. And so by multi-unit housing, I mean apartment buildings, condos, or any type of housing that has a shared walls. It can be defined differently, but I wanted to make sure to clarify that. Next slide, please. So how does secondhand smoke affect Latinos, in particular in multi-unit housing? Well, we know that 41.9% of California multi-unit housing residents are Latino, and which is putting them at higher risk of being exposed to drifting secondhand smoke. As you know, we live in California, or we're working in the state of California, and many times we have really great weather. Oftentimes we leave our windows open or our doors open, but that allows for smoke and aerosol to drift into non-smokers' units. And this can happen from people smoking outside from another neighboring building or from a balcony or patios or any other common area. And as we know, secondhand smoke also drifts through cracks, walls, and plumbing and ventilation systems. So it's very difficult for multi-unit housing residents to avoid secondhand smoke altogether when smoking and vaping is allowed on properties. And residents may be exposed to both tobacco and cannabis, as well as aerosol vapors from tobacco or cannabis. Latinos, like I mentioned, are more likely than non-Latinos to live in multi-unit housing, and this is due in part because Latinos tend to have lower average socioeconomic status, and it can be even more challenging for undocumented Latinos who often have limited employment opportunities, and without a social security number, it is more difficult to build credit for a home loan. So because of these and other socioeconomic barriers to homeownership, Latinos are more likely to live in multi-unit housing. So Latinos living in multi-unit housing are at increased risk for secondhand smoke exposure, even when they keep their own unit smoke-free. Latinos actually have one of the highest levels of smoking bans in their homes, yet they have one of the highest levels of exposure to secondhand smoke. A survey of Latino multi-unit housing residents in East Los Angeles found that 97% did not allow smoking in their home. However, 80% said that secondhand smoke had drifted into their unit in the past year. Now, this finding is very similar to more recent research that has been conducted. USC has conducted more recent research that I will be sharing in a little bit. In addition, we, like Rosendo mentioned, the people that are mostly affected are obviously those that are living with people who are using tobacco products, right? Those are the people that are most at risk of secondhand and third-hand smoke exposure. However, as I and Rosendo mentioned, secondhand smoke can drift, and also third-hand smoke can linger and stay on walls and locations, and so. Some of the most vulnerable people are the children, like Rosendo mentioned. They're the most at risk of being exposed to third-hand smoke because it lingers on carpets and furniture and things that they like to crawl and play on. Fortunately, there are effective strategies to reduce these exposures. Next slide. So one of the first strategies that we would like to talk about is just to basically encourage a voluntary tobacco-free multi-unit housing policies. So many people don't know this, but in 2011, the state of California passed a law that affirms that all property owners have a right to make the property smoke-free. So owners or managers have the authority to prohibit all forms of smoking within their units, within those units. So this is an approach that we can use. And we can encourage landlords to voluntarily adopt these policies. And this may involve meeting repeatedly with landlords or associations or HOAs or other representing or other associations that represent owners, as well as tenant organizations. Thank you, Rosendo. And advocates often mention, advocates often that are working in multi-unit housing sometimes often hear from people, well, I have, in particular smokers, they say, well, I have the right to smoke in my own space, in my home. But unfortunately, there is no such thing as a constitutional right to smoke, since the U.S. Constitution does not extend special protections to smokers. So smoking is not specially protected. It's not a specially protected liberty right under the Due Process Clause of the Constitution. So because there's no especially protected right to smoke, tobacco and marijuana control advocates can work to amend or repeal state laws that stand in the way of smoke-free efforts. Next slide. So the next strategy that we wanted to suggest is passing a citywide or countywide ordinance prohibiting smoking and vaping in all or some portions of units in the area. And ordinances like these are often most effective. They're most effective way to prevent secondhand smoke because they apply to all or most of the complexes or multi-unit housing in a city or in a county. Oftentimes when we have interviewed landlords in the past, that is a concern. They don't want to be saying, oh, I'm the one, putting this rule in the books. They'd rather say, oh, it's a city law, it's a county law, I'm following that. And so that also helps some landlords, in particular those landlords who may be hesitant to establish their own voluntary smoke-free policies. And as of April 1st, 2022, 74 jurisdictions or municipalities in California have enacted an ordinance prohibiting smoking in 100% of units in properties with at least 2 units in them. Next slide. When considering multi-unit housing policies, though, and when we're prohibiting or restricting tobacco use in multi-unit housing, it's super important to ensure that enforcement activities do not exacerbate social injustice or cause further disparities by excessively punishing individuals who violate the policy. So, for example, eviction can be seen as a really harsh and excessive punishment for low-income tenants who have nowhere else to live. So enforcement should prioritize education and norm change strategies, such as communicating with affected residents and other stakeholders about the health benefits of tobacco-free multi-unit housing, as well as building support, social support for the policy. And also super important is offering cessation resources to help tobacco users to quit. Often we do know that multi-unit housing policies can motivate people to quit, but we need to make sure and we need to ensure that we provide and we make those resources available to people. Also, community members and affected residents should help determine the most equitable mechanisms that will work for their community. Every community is going to be different, right? So every jurisdiction or city is going to have a different authorities, and but the community also have their priorities as well in terms of how they want their community to be enforced. So it's important to engage the community in these efforts. I'm really excited because we will have Jade Lee from BASTA later, who's going to be our panelist, and we will be asking her more in regards to how she was able to engage her community in ensuring that they established the most equitable policy in their county. Next slide. I briefly wanted to share some research that we conducted here at USC, and this is a study called Triangulum, Secondhand Smoke Exposure in Low Socioeconomic Multi-Unit Housing. And by triangulum, we mean the smoking of tobacco, cannabis, and use of electronic vaping devices for both tobacco and marijuana. And we conducted door-to-door surveys, and this was pre-pandemic, with tenants living in randomly selected apartment buildings of 20 or more units. So they were pretty large units. And we did this in apartment buildings in predominantly African-American communities, predominantly Latino, and predominantly non-Hispanic white communities. Next slide. The interesting part of our study was that we were able to compare between communities as well as between ethnicities. So I would like to share some of this research because I do think that when working on multi-unit housing policies, we have to consider some of these things when we're working on these policies. Next slide. So the first slide I want to share is we asked our participants, how much do you think people risk harming themselves physically if they smoke cigarettes or if they use marijuana at different frequencies or if they use e-cigarettes with either tobacco or marijuana or both at different frequencies? And so you could see the different options that we provided. Each bar represents the different options. Red is cigarettes, green is marijuana or cannabis, and blue is e-cigarettes. As you can see, and this bar represents people who say it's a great risk to somebody's physical health or harm. It will harm their health. So as you can see, we've done a really, really good job of educating people about the dangers of tobacco smoke, right? But we need to do a better job of educating people about marijuana as well as e-cigarettes. As you could see, there clearly is a very big difference in terms of perception of harm for each of these products. Unfortunately, as Rosendo mentioned, e-cigarette aerosols are just as bad as marijuana smoke as well as tobacco smoke. Next slide. We also asked participants if a person needed marijuana for a health condition, should they be able to use their medical marijuana in the apartment, even if there's a smoking rule in their building. And the reason I wanted to share this slide is because there is a high level of compassion for people that need it for medical use. And this has come up a lot in many jurisdictions. It has come up as a challenge and as a barrier, right? I did want to share, though, and point out that when we actually compared this data by community and by ethnicity, Latinos, the Latino community, actually, they have a lower agreement rate for this, the lowest proportion of agreement for this. So this slide shows the community rate, and the left is the Latinos, and the next slide is ethnicities. If you could go to the next slide, Rosendo, to quickly show that. Great, thank you. Now we're going to go to the next slide. This slide shows, we asked participants, would you be in favor of a partial or 100% tobacco and marijuana smoke-free and vape-free policy at your housing complex? And as you can see, a large majority of people want to live in a they will support a smoke-free policy. But what I wanted to share is that the Latino community tends to have a higher percentage of support for these policies. Next slide. Great. And so lastly, with all of this information, I want to, I want to just summarize, as we've highlighted here, that tenants are increasingly being exposed not only to tobacco, but also to marijuana and e-cigarettes. So it's important that we are including marijuana, cannabis in policies as well as e-cigarette in these policies. And also, we know that the majority of tenants want to live in a smoke and vape-free environment. When working on these policies, it's super important that education is super important. As I mentioned before, we need to educate people about the harms of using marijuana and e-cigarettes. And we also need to make sure that these are included in the policy. We also need to specify that outdoor smoking areas, if there are any, if there are allowed any outdoor smoking areas, that they should be at least 30 feet away from all entrances and exits to avoid smoke and aerosol drifting into the building. Lastly, when considering multi-unit housing policies, it's super important to utilize equitable approaches so that we're not exacerbating the existing disparities in the Latino community. So with this, like I said, we will continue this conversation a little later in the panel discussion. But for now, I'm going to pass it to Luz, who's going to be talking about tobacco-free outdoor venues. Thank you.
Thank you, Yaneth. So I'll go ahead and move to the next slide. There we go. So we'll be talking about enacting tobacco-free outdoor venues. So I think you're all fairly familiar with what a tobacco-free outdoor venue is. Examples are parks, fairgrounds, sort of patio areas, anything that's outside. But I really just want to jump into some of the research for why tobacco-free outdoor venues, or why an ordinance that promotes tobacco-free outdoor venues are important. So here we have one study where it was found that outdoor air pollution levels within a few feet of smoking were comparable to indoor levels in smoking homes and bars, which is very important. I think just generally we think, oh, we're smoking outside, there's so much, it's open air, we have a lot of space, likely you know, where if you're a smoker, you think you're at a healthy distance not to affect the other person. But as we know, when we're outside, a lot of that outdoor air is shared. So inevitably, we end up getting that, that pollution from someone who is smoking. And then another research has found that the air quality in outdoor venues where smoking is allowed can harm non-smokers in those settings. So we also have a study. Oh, 1 second, that jumped. And I'm not sure I can put it back, so that's fine. We also have another study that found a single lit cigarette in outdoor was detectable as far as 30 feet from its source. So sort of going back to what Yaneth mentioned earlier of why it's important to have that restriction of 30 feet away, that smoking can be allowed 30 feet, for example, from a doorway. Next slide. So we know that many outdoor venues can expose Latinos to secondhand smoke, but also just our general community, right? The general population. But right here, I just want to highlight a couple areas where, for example, sometimes it's you'll have more Latinos in these locations, such as fairgrounds, outdoor markets, such as remates, pulgas, yankees, also music shows, festivals, parades, rodeos, car races, and more. Again, they can be very general areas where the community at large will gather, but I also think of, for example, when there are Latino festivals where it can be more Latinos in those areas. And we know that banning smoking and vaping from outdoor venues protects the community from secondhand smoke. And in addition, bans also denormalize tobacco use and support those who are trying to quit. So that's why it's also really important. And now we just want to highlight a couple of things to point out when, for example, having a tobacco-free outdoor ordinance, what will make this a strong tobacco-free ordinance. So for one, you want to clearly define in the policy the outdoor areas that are tobacco-free. You also want to specify in the policy that all products that emit smoke or aerosols are prohibited. This includes cigarettes, cigars, e-cigarettes, and other vaping devices, as well as cannabis, products that are smoked or vaped. You want to develop a solid plan for implementation, including clear and timely communication. Use education and norm change strategies to increase support for the policy. And of course, allocate funds for bilingual tobacco-free signage, as well as remove ash cans and ashtrays that may promote tobacco use. Again, if those ash cans or ashtrays are not removed, it may indicate to someone who's unaware of the a new ordinance that you are not able to sort of use your tobacco device in that area. And with these ordinances, as well as with any ordinance, it's important to anticipate and plan for problems that can arise from the implementation of tobacco-free outdoor policies. An example is that people who can no longer smoke or vape on site may gather around nearby private property or on public sidewalks, creating a public nuisance. So again, with any ordinance, I think always planning for possible challenges that might come up and really having some sort of game plan as to what you can do to avoid these challenges, or what can you do if these challenges do arise. For example, with tobacco-free outdoor policies, definitely also planning for education within the community, as well as having cessation services. Again, there's some individuals who do use tobacco products who will need that sort of support. And we will be talking about this a little bit further when we talk to our panelists during the panelist discussion. But for now, I will go ahead and pass it on to Rosendo, who will be covering smoke-free college campuses as well as smoke-free vocational schools. Thank you.
All right, thank you, Luz. So far, we have talked about smoke-free multi-unit housing and smoke-free outdoor venues. Of course, both of which are very important areas in which Latinos are frequently exposed to secondhand, third-hand smoke. I want to continue the conversation and talk about another setting, which I know many of you are currently working on. And for those that perhaps haven't necessarily considered this, we want to encourage and recommend also for others to maybe emphasize making college campuses and vocational schools smoke-free or tobacco-free. So that's what I want to talk about for the next several minutes. You know, we are very glad that here in the state of California, we have made a lot of progress with universities adopting smoke-free college campuses. We know that the UC system and the CSU system have both adopted smoke-free college campus policies, and we know many others have also followed suit. So as of May of 2021, about 62% of California's 148 public colleges and universities have adopted comprehensive policies prohibiting use of all tobacco on campus. However, the concern is, or the remaining issue is that only about half of all California's community colleges have done so. The issue with that is we have, of course, a large Latino population in California, and many of the community colleges and other universities are what we know as Hispanic Serving Institutions, or HSI. These are institutions with at least a 25% Hispanic enrollment. And many of the community colleges are Hispanic serving institutions because they have a very large Latino population. So with that being said, the fact that we have many colleges which are Hispanic serving institutions that don't have a comprehensive smoke-free policy, this means that young Latino adults attending community colleges and other schools may also be at an increased risk of secondhand smoke exposure. This issue or this topic is very tricky when we talk about enforcement, and we'll have a panelist join us later today to speak more about this. But this is something that should be addressed to ensure that our Hispanic Latino students who are attending college are able to be protected from secondhand smoke and third-hand smoke while they're obtaining an education. Another area that we want to also emphasize are vocational trade technical schools. These are a very popular option for many, including Latinos, because they provide tailored training and education for a wide range of jobs. And so what we're noticing is that more and more jobs require a college education, but not necessarily requiring a bachelor's degree. And this is where many people may choose to go to a vocational schools because it's very focused, it's very tailored to a specific occupation, and they can then have a job right after. However, the issue is that there's little information known or published concerning tobacco-related policies in vocational schools in California. But of course, similar with community colleges, it seems that many Latino students are also exposed to secondhand smoke while pursuing their education in these institutions. So what we recommend is, of course, continue to identify how we can strengthen the existing comprehensive policies among those campuses that have adopted one, but also how can we ensure that all college campuses, universities, CSUs, UCs, community college, vocational trade schools are smoke-free campuses in which our Latino students are protected and they're not exposed to secondhand smoke. So the two first steps that we should all take is number one, identify which institutions currently have or do not have a comprehensive policy prohibiting tobacco use everywhere on campus. Once we've identified those campuses or those institutions, then we need to work with them first by creating a task force to have stakeholders from the college campus come together to address this issue, to provide a solution. Typically, we recommend that this task force be appointed by the president or somebody of power within the institution so that it provides much more credibility. Also, it would encourage more faculty and staff to participate if it is coming directly from the campus president. In addition to having faculty and staff present during those meetings or during this effort, we also encourage the involvement of Latino student groups, including MECHA or other organizations, whether it be fraternities, sororities, or other student clubs and organizations that are predominantly Latino, to also be a part of this conversation, because they are, in many cases, they're the ones that are most exposed to secondhand smoke on college campus. So we encourage to engage the Latino student groups to have their voices heard, to also provide their perspective, and also they can be a very important strategy, or they can be very effective in, once a policy is adopted, to then spread the word and educate other fellow students about the policy and what is being done. So they can be a very important advocate with this effort here. I know many of you are also working on this policy and are doing exactly that, working with students, student government, student clubs and organizations to really be the voice on campus, and have found some success in doing so. We also want to highlight specific recommendations, and these are also found on our policy platform. Number one is to specify in the policy that the use of all tobacco products on campus is prohibited. So this applies to also cannabis, and also whether it be cigarettes, as well as vaping products, electronic smoking devices, really anything that emits harmful smoke or aerosols. By specifying this in a policy, you reduce the risk of any type of gaps, you reduce the risk of any type of loopholes where people can then come and say, well, it doesn't specify electronic smoking devices. One thing to also note is the increased use of the one-time disposable vaping products to ensure that there's also some type of language in the policy that also gives you that flexibility to include any new or emerging product. So that way you don't necessarily have to go back to then update the definitions, but you already have the language structured in a way where it's specific, but also encompasses other tobacco products. You also make sure that you clearly state that the prohibition applies to the entire campus, including any satellite properties. Now, this is very important for any college campus that has perhaps an arena or a stadium in which concerts are held or events are held, where people from the community come onto college grounds to then attend an event. Because when you have a campus that has a smoke-free policy, anybody that goes, let's say, to that arena for a concert must also follow that policy. They are not allowed to smoke or use tobacco, including also cannabis, if that's clearly identified in the policy. And that's why it's also very important, and we'll touch on this as well momentarily, but to also educate not only on college campus, but also the entire community. So that way anybody who is planning to go onto campus for an event also knows ahead of time that they cannot smoke or use tobacco before they actually step onto campus grounds. Again, if they go onto campus, are not aware of the policy, signage is not clear, there's no enforcement mechanism, then at that point, quite frankly, the policy is ineffective. So it's very important to clearly state that, and also ensure that you're educating the community as well. You also want to include enforcement language in the policy that emphasizes education and norm change strategies. You'll notice that we're not necessarily promoting or advocating for handcuffing students for having a cigarette by the library, or even for faculty and staff. This is something that is complex, but we are going to be joined later on to speak more about this with our panelists. But we want to make sure that we really try to include equitable approaches to enforcement. Again, whether it be education or norm change strategies, this is also where it's very important to educate the student population as well as faculty and staff about this new ordinance. It might be that perhaps they're not necessarily trying to violate the policy, but they simply aren't aware that the policy exists or what the consequences of the policies are. With that being said, also we want to make sure that we alert all students, faculty, staff, and I'll include also the campus community, the surrounding community, so that those that, especially if that campus is very popular for events, that people know that if they're coming onto campus, they cannot bring or use tobacco. But we want to make sure that we let them know months in advance. We encourage you to work with your tobacco control advocates as well as media partners to ensure that the information is out to the public about the inability to smoke on campus. We want to make sure that we give people, similar to like smoke-free multi-unit housing policies, we want to give months in advance so that people know that the policy is going to be implemented. And last but not least, we want to make sure that we post tobacco-free signage at all campus entry points and gathering areas. These signage should be made available to clearly indicate which products are not allowed on campus. Again, if we're including tobacco, cannabis, as well as electronic smoking devices, we want to make sure it's very clear on the signage. If you have a very large Latino or Spanish-speaking population within the campus, maybe you might want to consider having signage as well in Spanish, especially perhaps when you have a lot of Spanish-speaking folks coming onto college campus grounds for various reasons. And last, we also want to make sure that we remove all bins in which people can then leave their cigarette waste, so that way we don't necessarily give the notion or the perception that smoking is still allowed. So we want to make sure we remove all ash cans from school campus to ensure that when we have the signage saying there's no smoking allowed, we don't necessarily just leave an ash can there. Again, it provides contradicting, like a very contradictive message. I want to transition to tobacco-free workplace, which is, again, an area that I think sometimes goes overlooked. And part of that might be because in California, we do have a smoke-free workplace law that prohibits smoking and vaping in most indoor workplaces, again, most. However, what this does not apply to are outdoor job sites. And these are job sites in which Latinos oftentimes are overrepresented. And for that reason, they're not fully protected by state law. So the first thing we want to consider, again, as I already mentioned, is many job sites that are outdoors, such as painting, construction, maintenance, and agriculture, does not fall within California smoke-free workplace law. And therefore, our farm workers, our parents and uncles and family members and friends who live in construction and painting, they are not protected from secondhand smoke or any other form of aerosols. And so what that means is that they're going to work on a daily basis and constantly being exposed to secondhand smoke or other harmful chemicals. But also consider or think about those that work in painting or agriculture, in which they're already exposed to pesticides, already exposed to other harmful chemicals, and then you add on to that the secondhand smoke. And so it really puts our community in a very tough situation in which they may have a higher risk of negative health outcomes, including certain types of cancer. To add to that a bit more, many of them, for example, if they are uninsured or perhaps not documented, they may not necessarily take time from work to then go get screened, to have an early screening in case they don't feel well. Because again, if they work in agriculture, perhaps they don't have accrued vacation hours, or they don't have holidays or sick time that they can take. If they don't work, they don't get paid, and so they're not unable to provide for their family. So we want to make sure that, to our best ability, that we make sure that these job sites are ones that facilitate healthy outcomes and don't necessarily put our Latino families and Latino workers in a tough situation and really poses a threat to their health. The law does not ban smoking in outdoor service areas of bars, restaurants. Again, many of our waiters, many of our cooks, our chefs, many of our Latino family members and friends work in the food industry. And again, in many of these settings, they're not going to be protected from secondhand smoke or even third-hand smoke at that. So similar to what we have already previously mentioned, we want to make sure that regardless of the occupation, our Latino workers are protected from secondhand smoke. And last but not least, our family members, our Latino community members that work in the hospitality industry, whether it be cleaning hotels or motels, or even cleaning apartments after a tenant moves out and before a new tenant moves in. We know that the law does not apply to, does not ban smoking in all hotel and motel rooms. We already mentioned that not all communities have a smoke-free multi-unit housing policies. So those that work in repainting and changing the carpets, those that work perhaps in cleaning motel and hotel rooms in which people are smoking are going to be exposed to high levels of secondhand smoke, but in this case, also high levels of third-hand smoke. If they touch the surfaces, if they're not wearing protective gloves, if they simply inhale the third-hand smoke residue that is still left in the room, if they also perhaps don't clean their hands and then eat right after. Again, this really puts our Latino workers in a very susceptible position to have really negative health outcomes. So we want to make sure that we address this gap that exists at the statewide level by addressing it at the local level. So with that being said, we want to encourage the following two strategies. Number one is to work with businesses themselves, similar to the policy that we talked about with multi-unit housing, to have a voluntary policy. Same thing applies to this. Have a workplace have a voluntary ban of smoking and tobacco use on their work site. Many locations or many businesses already have a worksite wellness program. Many of you perhaps might be familiar with, at the time it was called Champions for Change, in which they was a program that had worksite wellness to encourage more drinking of water, more consumption of water, fruits and vegetables, of exercise, right? So many businesses already have some type of worksite wellness to help their employees stay healthy. You might want to come in and plug in this voluntary ban as part of an existing worksite wellness program, or you might want to just simply create one entirely new. And in doing so, you want to make sure that you're very clear that what consists of a work site. If, for example, if it is a packing house and there's a voluntary ban that you cannot use tobacco within that packing house, but people then go and smoke in the parking lots, is that also considered part of the work sites? And again, that may be up to argument, but that's why it's going to be very important that in the policy itself, you specifically clarify what consists of work site. In that case, you might want to include the parking lot as well, and then ultimately have people leave or across the street to then use tobacco if they choose to do so. But the other option, this is the one that we recommend a little bit more compared to the previous one, is to work with city council and county board of supervisors to ban smoking and other tobacco use in all outdoor workplaces and all other areas, including hotels and motels. Of course, this is much more stronger because a voluntary ban is great. Don't get me wrong, it is great, but it might only exist within one business. But what about the nearby business or the business down the street? By having a city council or board of supervisors adopt a smoke-free workplace law, that means that all workplaces within that jurisdiction must follow that policy, must follow that ordinance, and you are more able to include an equitable enforcement option, whereas it might be a little difficult with the previous one. So we encourage all of us to work towards addressing these gaps at the local level to ensure that we don't have our Latino workers, family members, friends constantly exposed to secondhand smoke in their workplace. So with that being said, we're going to transition to our panelists, and we have them listed here on the screen, but we'll introduce them a little more momentarily. We are joined by Jay Lee from BASTA, from Alejandro Buenrostro from CYN, Dolores Vasquez from Si Se Puede, and Natalie Hammer from the Public Health Law Center. And they're going to share more about their experience with the policies that we have just mentioned to provide some recommendations for all of you who are working on these specific efforts. So with that being said, I'll pass it on to Annette to introduce our first panelist.
Awesome. Thank you, Rosendo. I'm really excited to introduce Jade Lee, who is the project director of BASTA, Bay Area Strength Through Activism, which is a resident-led initiative in the Bay Area BASTA is committed to working with residents who want to improve the health of their community through policy and systems change. In 2020, Jade started as BASTA's youth advocacy coordinator the day shelter-in-place was announced. Since then, Jade has virtually organized over 15 youth to successfully advocate for a comprehensive smoke-free multi-unit housing ordinance in unincorporated Alameda County, and that's why we invited her to come speak with us today. She was promoted to project director last August and now supports BASTA's youth and adult coordinators in organizing Hayward residents to fight for protections. Although she has no personal stories with tobacco use or secondhand smoke, Jade is passionate about the community organizing work happening in her hometown of unincorporated Alameda County. So we wanted to invite Jade because Alameda County recently passed a multi-unit housing policy that has become a great model for other jurisdictions, not only in terms of the policy, but in terms of how they got to that point. So they were able to pass a smoke-free multi-unit housing policy that is actually going to go in effect in this 1st of July, which is in a few days. The policy applies and includes housing with 2 or more units, including apartments, townhomes, condominium complexes, senior and assisted living facilities, long-term health care facilities, hotels and motels in unincorporated areas of unincorporated areas of the Alameda County. So no one is allowed to smoke inside their units, on balconies, porch decks, or patios, in any indoor or outdoor common areas, as well as if neighboring properties within 25 feet from any doorway. And if a person is accused of smoking, the county will start by educating the person about the law, and they may also issue some written warnings. And then if the smoking continues, violators may be subject to fines. But then these fines are progressive in terms of it starts low and then it increases. And so it's a gradual increase. And if you're smoking, your landlord may not evict you for violating the law. And this is an interesting thing that I think is really important. Oftentimes tenants' rights organizations will say, well, evictions are used, and it can be used to, kick people out of apartments. But in this policy that Alameda created, they actually included that no landlord may terminate a tenancy for multi-unit housing. So this is actually written into the law. So to get there, like I said, Jade and her team engaged the community and they dialogued for several years in regards to what would equitable enforcement look like, or what would this look like in their community. So Jade, thank you so much for being here. I wanted to ask you, can you please share some of the key strategies that help BASTA engage with the community members and other stakeholders on this issue?
Yes, thank you so much, Annette, for that introduction and a really good overview of our policy and the work that we've been doing. So first, I really want to note that our target audience is the Latino Spanish-speaking community living in multi-unit housing, and I would assume that, most folks on the call, most likely that is their target audience too. But I'm mentioning that because it's important that majority of our small team actually speaks Spanish. And is able to engage with the community intentionally while doing outreach and having one-on-one conversations. And so this is really being said with any group that you work with. If you have a team that represents the people that you are trying to engage with, it makes everything so much easier. It really, truly reaches the folks that you want to get to, and it creates this level of comfortability that often can take a lot longer. So there's a couple things that we've done in terms of engaging community members and other stakeholders. For community members, the first foremost thing that we did was go door knocking. And that sounds scary, but that's literally like knocking on people's doors, going in the evenings, going on weekends, and knocking and waiting for someone to answer the door and hopefully talk to you. And this was actually how we reached our targeted audience. Like we went directly to apartment complexes, made sure that we went onto properties that allowed soliciting, because there's a lot of signs that say like no soliciting or no trespassing. So we're very wary about that. And this is very much aligned with kind of one of the first steps any campaign should take, which is data collection. And this is to really understand, what are the community's experiences? What are the perceptions on this issue? Because at the end of the day, your team or your agenda or your contract or grant may have a certain agenda. But if the community that you're working with is like, we don't want this, like, this is actually not an issue for us, then you need to re-strategize and say, hey, actually, this may not be the best jurisdiction to do work in right now, because at the end of the day, the community members don't want it. So again, after we've collected that data, that was really a good opportunity for us to collect contact information with their consent, whether it's collecting surveys, collecting petition signatures, or letters of support. At the end of every conversation, we ask, hey, like, is this something that you're interested in being updated on? We'd love to keep you in contact, let you know what the city says, and kind of share this data with you. And so with that is how we collect contact information and continue to keep them updated in the loop with one-on-one conversations, which could lead to potential resident leaders. Another thing that I'd like to share in terms of other stakeholders is, finding out who in this area that you're working in has also done this similar work. We are very close to the city of Berkeley. I want to say about like 20-30 minute drive. And they also have a very comprehensive smoke-free multi-unit housing ordinance, and they've had it for a while now. And so we're like, these are the people that we need to learn from. It's okay to ask questions. It's okay to ask for help. And it's recognizing, who has already done this work that we can tap in with and actually have these discussions with. So when we are drafting ours or having conversations with residents, we are learning from experience. In terms of other stakeholders on another level besides other tobacco control advocates, I'm now going to be talking about how we engage stakeholders as in decision makers. And a lot of these were done through educational visits where, we are emailing them. We're having residents emailing decision makers and asking, hey, can we have a one-on-one conversation with you and just educate you about this issue? And we really push residents to be a part of these conversations. As Yaneth shared earlier, I was the youth advocacy coordinator previous to being the project director. And I was very lucky to work with youth that were like, I want to talk to our representatives. Like, yeah, let me schedule a meeting with them and let me share the data that we've collected. And so that's where a lot of these initial conversations started, to where these decision makers were like, wow, okay, like this is something that's going on. And this is great that we're hearing directly from you. And so we were able to meet them where we were or where they were by dropping materials off at their offices, attending meetings that they were at, and making general public comment, even if smoke-free housing wasn't on the agenda, and say, hey, this is what's going on. This is something that you should know about. And that has been really a huge part in the campaign in unincorporated and in our current campaign in Hayward.
Awesome. Thank you for sharing that. It's super important, and all the steps that you took. And can you please also describe the steps taken to ensure that the ordinance included an equitable approach to enforcement? I know we talked about that, but how did you get there?
Yeah, so as I had mentioned earlier, some of the stakeholder meetings included partners in the area. This was with the City of Berkeley Public Health. This was with Alameda County Code Enforcement, who we were hoping to partner with around enforcement, with public health, with the Americans Non-Smoker Right Associations, and had continuous conversations about, what does it mean to be equitable? What does it mean to be equitable for the community that we're living in, given that the Bay Area housing, there's a real housing crisis. It's really hard to find anything affordable here. And looking at both ends of the picture, as if we were a smoker, what would our situation be? If we were a neighbor dealing with it, what would our situation be? If we were the landlord, what would our situation be? So really looking at it at all perspectives. And once we felt that we had recommendations that really represented what we felt was most equitable, we brought it right back to the community. We said, hey, you know what? Just because we think that this is something that should be working or that is equitable in our definition, We hosted multiple community forums where we had translators, where we hosted in English and in Spanish, and one for youth, given that they had such a large part of the campaign, and went through recommendation and say, hey, does this make sense to you? Do you agree? Does this make sense, but do you disagree? Does this not make sense at all? What is your feedback on this? And to really have another full run through of what does the community think again? Is this equitable in their eyes, given that they're going to be most impacted? And brought that back to council members, decision makers, representatives to share. We have had multiple discussions. We've had multiple discussions with the community, and this is what they think should work best.
Awesome. Thank you so much, Jade. I think we've learned so much from your experiences, and thank you for being so willing to share all of this with us. And I hope that others see this as a model and take some of these strategies and utilize them in their approach as well. So I would like to thank you so much, Jade. I would like to now introduce Luke, who's going to introduce the next panelist. Thank you.
Thank you, Jade, and thank you, Yamneth. So I'll go ahead and introduce now Dolores with Si Se Puede. She's the outreach coordinator for Si Se Puede, and the reason that we brought her here today is so she can discuss a little bit about smoke-free outdoor venues that Si Se Puede has done, specifically in parks. So, for example, they had a recent win in Corning with smoke and vape-free parks, and they're also hoping to do the same work in Gridley. So I'll let you go ahead and introduce yourself further, Dolores, but as you introduce yourself, I'm wondering if you could also speak a little bit about the strategies that have been most successful in terms of pushing forward smoke-free outdoor venues.
Yes, my name's Dolores Vasquez, and I work, like she said, with the California Health Collaborative, Si Se Puede. And we've been working on Corning, which kind of fell into our lap. We were going to work on parks there, but the chief of police, he had already started working on it. So we kind of jumped on it with him. And the policy passed in 2019. And so we kind of just went with it, and we helped educate the community and also continue on with it. And the thing that we're working with right now with them is signage. It has been in place since 2019, but there's no signs anywhere. We've been trying to get them to talk to us about signage and how we can help them to put up signage. They have a set of rules, which the lettering is very small, where it says no smoking and no vaping. So recently we had a roundtable with the police department, with all police and fire and stuff. So we had a roundtable with them, and the chief was there. So we talked to the chief, and we said, we have been trying to get signage or find out how we can get signage to you for the parks, because we have been doing observations in the parks, and there's a lot of tobacco litter. So they are smoking in the parks. So he jumped on the wagon with us, and he says, okay, I'll take all the help we can get. So we're working on signage right now, including the marijuana and everything. So we're working on that now. Esther's working on making that happen. So we are still educating at every event that we go to about the smoke-free parks. So now switching over to Gridley. Gridley right now, we are working with Gridley. And my key thing for any policy that we work on is education. Educate, educate, educate. We have to educate everybody in the community. We have to go for different organizations who use the parks for fundraisers or anything that they're doing, such as Rotary and the Lions Club. So we go to them when we do presentations. We went to a health class at Gridley High, and we recruited some youth. So we have some in the way of 6 to 7 youth who are with us everywhere we go. We educated them about what we're working on, and about tobacco, about secondhand smoke, and also about the flavors, about everything about tobacco that we can that would interest them. Now we have them where they went out, they're very shy at first, But once they got going and they saw what was going on and what we were talking about, then they started sharing what everything that we were talking about, what they see and what they think should happen. We have an advisory board in every jurisdiction where we work. So they help us because they live in that community. So they have helped us a lot. The kids, the youth have done presentations to different organizations in the community. They did a roundtable. I believe it was in May. They did a roundtable with the community. And so they had a panel and they basically put everything together. They're the ones that did all the presentation and asked the questions and everything of the panel. So they've been very active. They've done presentations to the policymakers, which is our city council. We have two champions right now, and they're both Latinos, and they are very for it. And the presentations that we have done, this council seems to be on board. They're very listen very closely to the youth. And we found that when you work with the youth, they listen to the youth because they are our future. So they go to all the events that we go to and they do presentations. So right now where we're at in the Gridley area is they're going through the policy, trying to the wordage and everything, and they're deciding now what is going to work best for them. So we are still out there educating, even though we are doing presentations and everything to the city council. We will continue to do education with the community. And when we did the roundtable, though, that's been one of our biggest barriers, is getting the Latino population to the events that we go to. We've offered food, we do translations, we've offered a lot of different entities. And we did have 8 parents come to the roundtable, which was to me, it's a win because we did get some. So that's been our biggest challenge, is getting the Latino population involved. I did radio shows. We've done interviews on our Facebook. And so we're trying a lot of different ways. And it seems like now we have the people coming in and talking. We collect signatures. We take those signatures to the city council saying, these are the people who want the parks to go smoke free. We've tried a lot of different ways to bring the people in. But like I said, we had a movie night, a free movie night to get the parents and the kids to come in. And we had educational materials out there and stuff for them to read. We offered food and we had only allowed 4 cars come. So it's a challenge, and it is, but we just keep choosing different ways of meeting our population. So that's what we've done so far.
Thank you, Dolores. I guess I just want to highlight a couple things that I heard in terms of what has really pushed, your success in pushing forward smoke-free ordinances, which you mentioned, education. I think that's very important, not only at the community level, but also, educating your decision makers and getting both that community buy-in as well as a buy-in from your decision makers. And in terms of some challenges, signage was a challenge, as well as getting Latino community members to actually attend certain events. But I heard a little bit about how you overcame that was, trying to meet them where they're already at the events that they're already going to, using a lot of different modalities, whether it's social media or actually attending in-person school events, community events, to try to engage with them there where they are already at, or even offering, food, drinks. I think that's always a nice way to try to gather individuals. So again, thank you so much, Dolores, for the information that you provided. It has been very helpful, and it's really nice to learn about what CISA is doing. So I'll go ahead and pass it on now to Rosendo so he can go introduce our next panelist.
All right, thank you, Luz, and thank you, Dolores. I'll introduce our next panelist, which is Alejandro Monrostro. Alejandro is new to CYN, but he's not new to the area of campus policy and smoke-free tobacco work. For those who are not familiar, CYN stands for the California Youth Advocacy Network, and they provide training and technical assistance to support changing the tobacco use culture in California schools, colleges, and universities, as well as military installations and other youth and young adult communities. So with that being said, I want to go ahead and introduce Alejandro. And also want to start off with our first question. So Alejandro, of course, we've already touched on some of the challenges that we face when we're working with these different settings. But really, in your experience, what are some recommendations or best practices for successfully implementing a smoke-free college campus, specifically in Hispanic serving institutions?
Perfect. I just want to say I'm honored to be here. Thank you for having me. And to answer your question, I think the first one I would be focusing on would just be awareness of policy, as well as just policy awareness on campuses. Establishing yourself on these campuses as a beacon of information and resources. So if anyone does need any assistance or support within their health behavior changes, they can rely on that, or at the very least know where to go if they should ever need to seek that or seek that for someone else. Oftentimes it is an issue just because, especially with lower education K through 12 systems, it is so ubiquitous for it to be found that smoke-free is widely implemented all across the board. No one's, smoking outside their kids' elementary school, at least not anytime soon. And so it's hard because it's sometimes a preconceived notion that higher education, whether it's community college, private or public institutions, are in a continuation or extension of that. Oftentimes people just think that it's there, or just don't really care to even ponder it in the first place. So that being a very big one. Secondly, also ensuring that there is a tobacco treatment plan available, being able to establish programs and organizations such as the Latino Coordinating Center, as well as the California Youth Advocacy Network onto these campuses for the utilization of staff, students, and faculty is also extremely important. And then the last one being, if there isn't anything available, usually this is contingent on logistics, especially within the public health sector. I think oftentimes things get overlooked or underfunded, especially when it comes to prevention work, since there is no quantifiable data to show for the work that we do at times. So being able to disseminate and readily offer services and resources that would be able to enable people to get to do and engage in this advocacy policy work, as well as just make healthy choices for themselves and others.
Absolutely, thank you, Alejandro. So with that being said, also, once a person or an organization establishes themselves as a credible source on campus and is able to make these connections with perhaps faculty, staff, students, and really has this policy, a lot of support, what recommendations would we provide in regards to the enforcement aspect of the policies, ensuring that it is equitable?
Yeah, absolutely. And I love that question. So I would say for being able to ensure and what recommendations to take when doing this type of work, we can start with what not to do, I think would be a good spot. While a lot of campuses do have the potential and the power to be able to do enforcement activities, such as issuing citations for use on campuses that do not allow for the usage of tobacco, marijuana, or e-cigarettes. Ensuring that we're not penalizing students, that we're wanting to foster a relationship and a partnership with these individuals, as opposed to trying to teach and educate and advocate by negative enforcement. I think especially with campaigns like DARE, where we've seen that negative enforcement hasn't really been very successful. We should learn from those mistakes and be able to improve and innovate for the future. So be able to bring people in, I think, without so much trying to demonize them for whatever the current status of their consumption patterns look like.
Absolutely, yeah. I think the last thing we want to do is have to demonize our students or demonize even faculty and staff, for the tobacco use, but rather try to create that norm, that social norm that simply, tobacco use on campus is not allowed. Of course, we know obviously the health consequences, but I think it also just creates a better environment to facilitate learning, a better environment for also our community members to join or who go onto campus grounds to simply walk around or to attend events. And I think it really makes it much more enjoyable. We don't have to worry about secondhand smoke and constantly smelling the tobacco in the air. So again, thank you, Alejandro. Appreciate the information that you shared.
Absolutely. And then I did quickly forget to mention two examples of some of these strategies could look like. The first being just creative signage. I know this is something that a lot of my the other panelists have echoed within this webinar, is being able to visually engage and once again physically and socially establish our presence onto campuses. As well as just innovative programs such as CYAN, the California Youth Advocacy Network. We do currently have youth projects as well as higher education projects. So as mentioned earlier, I do work on the college side of things, but we do have a youth board of directors that work in advocacy and policy work within tobacco cessation, engaging them from the pinnacle age range of high school, and then also continuing into higher education with COUGH, which is a program I personally help oversee, and that would be campuses organized and united for good health. And they also do a lot of the similar work just within a higher arena, with it being within higher education. Oh, and then I also did forget to mention, I do have a lot of firsthand experience, not only with my professional work right now, but oddly enough, I actually interned for an organization exactly like this. I actually work with the company CYAN now when I was a sophomore in high school. So the lasting effects, I think, also are very, very important for being able to engage youth for this long, because this was, an endeavor I took on 4 years ago, and then here I am now post-grad, getting to do this amazing work.
Oh, that's excellent. That's excellent. The fact that you were involved in high school and now you do this for a career. So that's excellent. Thank you for sharing that, Alejandro. Again, thank you for also joining us this morning to share your insight. All right, I'll pass on to Yanet to introduce our next panelist.
Thank you. And just because we're low on time, I actually just included the Natalie's bio in the chat so you can all read it on your own. But I will go ahead and just start with the questions. The reason we invited Natalie is because she provides a lot of technical assistance to many jurisdictions, not just in California, but all in other parts of the country as well. And she has helped many jurisdictions around the issue of workplace policies. So I wanted to ask you, Natalie, what are some of the important elements to include in smoke-free workplace policies that make them strong and comprehensive? And if you can also add any recommendations that you can add on how to enforce these in an equitable manner, and we'll just add that, loop it all together.
Thanks, Janet. Yeah, so when we're working on these policies, one of the first important things to start with is looking at the definitions and in defining the really important terms and making sure you're including exactly the types of behavior and products and whatnot that you want to include in the policy. So we were talking earlier about cannabis and things like that, and making sure these policies have definitions that include all the products and all the ways that you can use or smoke different things in the policy. And then besides looking at the definitions and really crafting those to be exactly what you want them to be and cover exactly what you want them to cover, you also are thinking about who, the what, and the where. So those are really important questions when you're thinking about workplace policies specifically. So who are you addressing? So sometimes you're addressing just your employees, but sometimes you have visitors or clients that come in, or if you're in like a healthcare setting, you might have patients. And so you have to think about all the different who's that you want to comply with the policy. What is like all the behaviors you want to include. So oftentimes the workplace policies is not limited to smoking. It also includes non-smokable forms of tobacco, commercial tobacco. So like chew or something like that is something you might restrict. And then the where is also really important. Do you want to have it be the whole workplace, outdoors and indoors? Do you want it to be have designated smoking areas, or do you want to have like a setback or something like that? So those are all really important questions as you're thinking about writing the actual policy. And I think, Janet, you mentioned this, but we actually help this with it, or help anyone with this. So you can reach out to us and we can help you. You don't have to remember all these things when you're going into it. We can talk through those with you. But as you are thinking about it, those are kind of the important questions. And then as far as enforcement goes and workplace policies, it's kind of a unique situation where the employer will know and also can craft benefits, like especially health insurance and things like that, can make sure and know exactly what benefits their employees have and connect them really directly with those benefits, as opposed to some of these other policies we talked about where it's just kind of like general public. So it's really a unique situation, and a focus and emphasis on cessation and helping people comply with the policy is the most equitable way to enforce these types of policies.
Awesome. Thank you so much, Natalie, for sharing all of these important tips. And like you mentioned, anybody can reach out to you. And actually, I would like to invite all the panelists, if you wouldn't mind putting your contact information in the chat, because if somebody has, would like to contact you in the future, they can do that. Now, I would like to pass it to Rosendo. I'm not sure if we have enough time for some question and answers. I know we're low in time.
Yeah, thank you, Nathan, and thank you, Natalie, for the great information. We do have a few minutes. I do want to just see if there's any additional questions. I believe there's a few questions in the chat box that we were able to address. I want to see if there's any additional questions for the panelists, or anybody from the Latino Coordinating Center, from any of our participants here this morning. So real quick, I do want to briefly, in the chat box, I'm posting the link for our policy platform, which of course includes all the content that we included or that we covered during today's webinar, as well as our previous webinars as well. We encourage all of you to take a look, to review that, and hopefully that serves as a guide for the work that you're doing with these specific policies. Again, we know that many of you are working on these policies where you guys are the experts in this field. So we really want to be of service to the work that you're doing, the important work that you're doing, to ensure that you are successful in the implementation of your policies. I will also say that we are going to be sharing the recording for this webinar. We can also share the slides for those that are interested in the slides. In addition, the recording will provide two options, two methods. One is via Zoom with the Zoom link, but also want to let everybody know that we also upload our recordings onto our YouTube channel, which I just posted a link onto the chat box. So if you were unable to join any of our first two webinars, you're welcome to check the link and view our webinars on our YouTube channel. And as Ina mentioned, we're going to be creating a FAQ or a Q&A form and sending that out to everybody. We're covering some of the questions that were brought up during our time today. I know there's one question that Brian provided regarding ash cans or ashtrays that I know Natalie provided some insight to. So I think that would be great to also emphasize for all our participants here. I think we might have an additional question that might have not been addressed. But I also want to see if there's any additional other comments or questions from the field.
I would also like to remind everybody that, as you all know, our evaluation is super important for all of us, right? And so it would be really helpful if you can please complete our survey. I did paste it in the chat, but you will also be receiving an email directly from me. You may have already received it, but for those participants that registered while the webinar was going, you'll probably receive it in the next few minutes in your email as well. Just in case you can't grab the link right now, you'll have the link in your email. So thank you in advance for taking our survey.
Yeah, absolutely. And I think we did answer all the questions. So again, we appreciate everybody taking the time to join us this morning, and to hopefully you ever take something important from today's webinar. We'll have another webinar later on in the next couple of months, so stay connected to partners and to our listserv if you're interested in joining us for our next policy webinar. But other than that, have a great rest of your morning, and we'll talk to you all soon. Thank you, everyone.
Thank you, everybody. Bye.